All right. Hello, everyone. My name is Andrew. Thank you for taking time out of your busy schedules today to listen to my presentation. The topic I'll be talking about is comparative analysis of efficacious prophylactic vaccines combating the SARS-CoV-2 virus. Now, the specific question that I'll be answering today is, are there any major differences in adverse event incidences between efficacious prophylactic vaccines combating the SARS-CoV-2 virus? Specifically the Pfizer and Moderna vaccines in particular. Now, before we get started, we'll need to get everyone familiar with what exactly I'm talking about. So what is SARS-CoV-2? SARS-CoV-2 is the effector virus that causes COVID-19. COVID-19 was first declared a global pandemic on March 11th, 2020. And as of May 14th, 2021, or today, there have been over 32 million cases and 583,000 deaths in the US alone. In response to this deadly virus, 3 vaccines have been approved by the Federal Food and Drug Administration. Moderna's mRNA-1273 vaccine, Pfizer-BioNTech's BNT162b2 vaccine, and Johnson & Johnson's 8026.cov2.s vaccine. These are all prophylactic vaccines, meaning that they're preventative vaccines designed to build immunity in the patient. The goal is to create antibodies for antigens, thereby making the host immune to the associated illness. Now, how and why did I choose the specific topic that I did? Initially, I was interested in the immune system, T cells in particular. After considering a variety of options, I was looking into T cells and their role in a variety of severe diseases, such as chronic obstructive pulmonary disease or COPD. I was also looking into T cells and their role in COVID-19. I found this relation to COVID-19 to be the most in line with my goals, as I had done a bit of disease research in previous years. On top of this, COVID-19 was this big thing at that time. It was affecting nearly everything in life. So I wanted to do something beyond just sewing masks or gathering donations. And that's why I chose to research COVID-19. Eventually, I decided to research the adverse events in these vaccines, as I could incorporate statistical analysis, another area I was interested in. This was also in part due to the fact that I couldn't get into the lab because of social distancing guidelines. So as a result, I did a completely distance or remote project, making researching the adverse events of these vaccines suitable for my goals. I also chose this topic as there was a clear gap in literature to review or to fill. Given how new these vaccines are, there is little research comparing adverse event incidences between these efficacious vaccines. And that's where I started off my project. The main goal was to determine if there are any significant differences in adverse event incidences between COVID-19 vaccine recipients, and data was taken from both during and post-clinical trials. My personal assumption was that there would be no major differences in any adverse event category, whether it be mild, moderate, or severe. I assume this because the immunogenicity percents of the Moderna vaccine and the Pfizer vaccines are really similar. Moderna has a percent of 94.1 and Pfizer has a percent of 95. Now I'll explain how I went about answering my research question. I use a quantitative method, a retrospective secondary data collection and analysis. The first step was to determine which vaccines to be analyzed. As a result, I began with a vaccine search on clinicaltrials.gov, as this was a reliable government database with all current vaccines in development featured. I searched for COVID-19 vaccines, and after subjecting the results to conditioning filtering, with conditions such as randomized and single blinding being required, narrowed down this list to Pfizer, Moderna, and Johnson & Johnson. Later though, Johnson & Johnson was dropped from the analyses as there simply wasn't any data available. The clinical trial papers were phase 1 and phase 2, while Pfizer and Moderna both had phase 3 released. In addition, the later database that I used, the vaccine adverse event reporting system, didn't feature any data there either. And that brings me into my collect data phase. I collected data from clinical trial papers from the New England Journal of Medicine. I collected vaccine post-clinical trial adverse event incidences from the Vaccine Adverse Events Reporting System, or VAERS. This database is managed by the CDC and the FDA and is a passive reporting system, which means that it relies on individuals to send in reports of their experiences. Anyone can submit a report to VAERS, including parents, patients, and healthcare providers alike. And in terms of how I gathered data in a single data snapshot on February 16th, 2021. This was done so I could extract the data and analyze it all at once. It would be difficult to continually update the statistical analyses and data sets, so this arbitrary date was selected for time efficiency and convenience. At that time, there were 60,642 total adverse event reports between the years 2020 to 2021. These included vaccines other than Pfizer and Moderna, such as the influenza vaccine. Now, this is a screenshot of the raw extracted data. As you can see here, there are patient numbers on the left side and the description of the adverse events reported on the right side. Now, as I'm sure you can tell, it's pretty difficult to tell what exactly is going on, like who experienced what, how many patients experienced that. As a result, I had to manage and filter the data. Of the total 114 adverse events filtered, from the total 114 adverse events, I filtered these down to 15 major adverse events, 5 mild, 5 moderate, and 5 severe to represent the respective categories. I then sorted and counted based on vaccine type and adverse event type. Following this, I performed statistical analysis using GraphPad Prism and chi-squared or Fisher's exact tests, as I was using summarized counts rather than individual entries. I was testing for significance with p-values less than 0.05 to determine if one vaccine elicited more of a certain type of adverse event than another among those who experienced adverse events. And now for the results. After filtering and data managing, the total number of patients who reported adverse events from the initial 60,642 was 15,760. Pfizer reports were 11,045 and Moderna reports were 4,715. After an additional phase of filtering and data managing, the number of patients who reported a specific type of adverse event is seen here. The first 5 columns represent the mild adverse events, that is injection site pain and swelling, nausea, chills, headache, and fatigue. The severe adverse events included nerve injury, bedridden, intensive care needed, dyskinesia, and memory impairment, just to give you perspective of where these adverse events range. As you can see, there are less incidences of moderate and severe adverse events than mild adverse events, which is to be expected. In this table, you can see the calculated percentage of patients who reported a type of adverse event among those who experienced adverse events in clinical testing. The X's represent lack of data, as the clinical trials did not measure that adverse event. As you can see here, greater percentages of Moderna vaccine recipients experienced adverse events during clinical testing than Pfizer vaccine recipients, with percentages of 63.7% compared to 31.5% and 71.1% to 55.0%. More on that later. Now for my statistical analyses. As mentioned earlier, I statistically analyzed with a p-value of less than 0.05, and these are the results of the chi-squared or Fisher's exact tests. From the table, you can see that 5 adverse events were found to be significant, meaning that Moderna experienced more incidents of these adverse events among those who experienced adverse events than Pfizer. These adverse events include injection site pain and swelling, nausea, chills, headache, and paresthesia. An area I want to call attention to are the mild adverse events. From here, you can see that 4 of the 5 mild adverse events were found to be significant. That is 80%. In addition to this, moderate and severe adverse events were all found to be non-significant, save for paraesthesia. This mild adverse event discovery is in line with the calculated clinical trial percentages. Among these 5 adverse events, moderate recipients experienced more incidences of adverse events. And so, in answer to the initial research question, Moderna mRNA 1273 vaccine recipients experienced greater incidences of mild adverse events than Pfizer BNT162b2 vaccine recipients among those who experienced adverse events. Of the 5 representative major mild adverse events, 4 of them were found to be statistically significant with p-values below 0.05. In addition, the calculated percentages of adverse events compared from Moderna to Pfizer are also in support of this conclusion. While in terms of quantity alone, Pfizer vaccine recipients experienced more adverse events overall, but one must keep in mind that there were also around 7,000 more Pfizer entries in the VAERS database. This refutes my initial hypothesis that there would be no major differences given the drawn conclusion. Now, what are the implications of this? What are the limitations? A major implication is that it's highly relevant to selective vaccine administration. For example, given that the Moderna vaccine elicits more incidences of mild adverse events, this vaccine could be given to an individual who has a stronger immune system. For example, if we have a patient that is more susceptible to increased incidence of adverse events, they should be given the Pfizer vaccine over the Moderna vaccine to encourage a more safe immunogenicity inductment. In addition, this also supports overall vaccine safety. It assuages fears that one vaccine is better than another in terms of moderate or severe adverse events, given that the 2 vaccines have non-significant numbers or percentages of those adverse events. In addition, this conclusion also provides support for these new vaccine vectors. The Pfizer and Moderna vaccines are both RNA prophylactic vaccines, which are pretty new to the prophylactic vaccine field itself. This finding that one RNA vector vaccine induces more mild adverse events than the other can demonstrate that a certain method of developing these vaccines is better than another, thereby boosting the field further. In addition, it also demonstrates consistency across moderate and severe adverse events, additionally helping to guide future development. Now for the limitations. A major limitation of the research was that not all adverse events were accounted for. As stated earlier, from the initial 114 adverse events, only 15 were filtered down to represent the overall data set for the respective adverse event severity. This was done as it's more time efficient. I didn't have enough time to go through all 114 adverse events to conduct statistical analyses for, especially given the lengthy manual data management process. Another limitation is the passive reporting system that is VAERS. Given that not all patients who experienced adverse event necessarily reported to the system, this could induce an underrepresentation of the overall population. And finally, another limitation is the possibility of human error. Of course, I could have, without knowing, accidentally deleted an entry somewhere or added an entry somewhere. And this introduces additional bias and inaccuracy in the result if it occurred. And that's all for my presentation today. Thank you for listening.
Well, Andrew, you've had an opportunity to prepare for these oral defense questions, and I will be asking you one from each of the categories that you saw: the research process, your depth of understanding, and reflection on the inquiry process. And my first question for you is, how did your review of the methods used by scholars in the field inform your selection of the method you used to ask your research question?
Well, as stated earlier, given the COVID-19 pandemic, I wasn't able to get in the lab, meaning that I had to conduct research from home using online resources. With this unconventional way of researching, I was even more reliant on outside help and the surrounding literature. My background research helped to inform my selection of a research method or process, as it introduced me to the idea of secondary data analysis. Instead of collecting primary data myself, I could simply analyze data already collected. And especially given my topic, which is counting the number of adverse event incidences, I'm pretty sure it wouldn't be time efficient to, go around and ask everyone who received the vaccine, oh, did you experience this kind of adverse event? Did you experience that kind of adverse event? As a result, this secondary data analysis method was appropriate for my research project.
I'm curious if you can tell me how your findings provide direction for future research in this field.
Well, my research provides a direction for future research, as analyses can still be done on a variety of vectors. For my specific topic, which is comparing different vaccines, as mentioned earlier, there was a lack of Johnson & Johnson data, which is a facet for further research. In addition, there wasn't any demographic data. So if one can obtain and conduct additional analyses, a more comprehensive understanding and conclusion can be made. In reference to the field overall, my research provides direction for future research, as it demonstrates that one RNA vaccine induces more mild adverse events than the other vaccine. This can be used to guide further research in RNA and DNA vector vaccine development, as it could influence how these studies are conducted.
Excellent. My last question for you, Andrew, is if you could revisit your research process and think back about how you did it, what would you do differently and why?
I think a big part that I would revisit and revise is to find a more efficient way to filter and manage my data. As you saw from the screenshot I took of the VAERS database, oh man, there was a whole bunch of text just on the page. So although some of it was computer supported, a majority of the data that I gathered was finalized through myself, manually looking over and checking it to make sure it was accurate. And a majority of it was manually conducted by me to find the actual data to statistically analyze. If I had used a computer program, that would mean the process would be sped up greatly, and I could have included other adverse events in my analyses, which makes my results more comprehensive and representative of the group they were taken from. In the future, based on this discovery, before I begin my data managing process, after I finalize a research plan, I proposed myself to find tools to better help me with my research process to speed up this process later.
Excellent. Well, Andrew, with that ends the formal portion of your presentation with oral defense.